Hello, everyone. It's Monday, March the 21st. I just see myself in the picture and everything. I've had a wonderful, wonderful morning, some bill signings with a lot of wonderful kids, and had the opportunity to get my picture with them. And you know, they renew your spirit in every way. I mean, you know, just absolutely beautiful children and wonderful families, and so. We had a really good time signing the bills and doing the bill signings. I know that's why we're a little late, but you know, really good stuff. You know, we have only 5 additional deaths. That's 5 too many. We all know that, but I'm sure it's over the weekend. It seems like over the weekend, you know, we have a cleanup and everything, and we sometimes don't get all of them reported in, but. We haven't seen a number like 5 in a long time, so I'm always thankful for every single anything in regard to this terrible pandemic. But the 6,647th death is a 62-year-old male from Cabell County. The 6,648th death is a 56-year-old male from Brooke County. The 6,649th death is an 86-year-old male from Wirt County. The 6,650th death is an 84-year-old female from Raleigh County. The 6,651st death is a 73-year-old female from Wyoming County. First and foremost, know that these people are not just numbers. These people have loved ones and friends and family, and it's tragic beyond belief for them, and who knows what they've gone through. So please remember them. Please reach out if you know them. I mean, for crying out loud, it's a time when we've pulled the rope together. There's no question about that, but there's 6,651 West Virginians that we've lost. Our active cases are pretty good compared to where they've been for a good little while. There's 623. That's the lowest since July the 2nd of 2020. You know, we're heading toward, you know, that's probably, I don't know, 21 months ago. And so we have 333 new positive cases. Our daily positivity rate is at 2.66. We continue to come down really slowly on our cumulative rate at 8.29. We have 198 people that are hospitalized right now, 64 in the ICU units and 34 on ventilators. Our map is solid green except 2 counties that are yellow. The rental assistance program, you know, there's Erica Balgus that's going to come on, I think, and talk to us some more about that. And she's joining us now. And there's going to be another program right on the horizon for people that were homeowners, you know, and below a economic line, you know, that there's homeowners, and we'll get into that and everything, you know, but there's dollars on the way from the rescue program that if you were a homeowner that you're able to qualify for. But Erica Balgus is going to talk to us. You know, she is the director of the West Virginia Housing Development Fund, and she's going to talk to us in just a second here. But again, I remind people over and over and over about the rental assistance program is not only for renters, but it is also for landlords. But Erica, maybe you could come on now and talk to us.
Thank you, Governor, for announcing this new program. So the rental program that the governor's been talking about the past few weeks is still up and running, and that's assistance, like the governor said, that helps both our renters and the landlords get caught up where they were behind on the pandemic. And what we have new to introduce today is we have a similar program for West Virginia homeowners, known as the West Virginia Homeowner Rescue Program. And this program is designed to help homeowners that have fallen behind because of the pandemic. The program can provide assistance for past due mortgage payments up to $15,000, past due utilities up to $2,500, past due insurance, property tax payments, and other housing costs up to $5,000, $300 in internet assistance, and $500 of assistance on certain down payment loans. To be eligible for this program, your income cannot exceed 150% of the area median income for the county where you reside. Your primary residence must be in West Virginia. And this can be a single family home, a condo, a townhouse, mobile homes, or duplexes. There must be a related COVID hardship, such as a decrease in your income or an increase in expenses may be related to the pandemic. And it's important to note that this program is not just for people that have a mortgage loan on their home, but someone that owns their home outright that might have fallen behind on property taxes, for example, can also get some benefit from this program. We're going to be starting accepting applications a week from today on March 28th, and you'll be able to apply using your computer, a tablet, smartphone, or request a paper application. If you have internet or technology issues, we can help you with a paper application. And I just want to encourage everybody that's a homeowner in West Virginia that maybe has fallen behind, please visit our website. There's much more information there about what's covered, what's eligible, and how the program is going to operate, and also a list of the documents that you'll need to provide when you fill out your application. So again, this is very similar to the rental program, but for homeowners.
Okay, Erica, listen, thank you so much again, and we'll continue to try to pump out the information, but you know, what we really need more than anything right now is we need our media, the people that have joined us and everything, to amp this up and get the news out to everybody. We'll be pushing the news out in the governor's office, and I'm sure Eric will be pushing it out in her office and everything, but this is major dollars that can flow into West Virginia. The multiplier effect of those dollars is enormous. And absolutely, we want any federal dollars that are available to the state. We want to try to capitalize on that in any way we can. So nevertheless, if you're a homeowner now, you've got to pay real attention to this, because especially if you're hurting in any way, you know, maybe we can really come, you know, running to the rescue and help you. But not only that, this is really a major stimulus for our economy in West Virginia. And I know our economy is already doing great stuff, but let's just make it do better. I mean, that's all there is to it. Another announcement that I have today is a new free online tool to help people learn when they may be due for their COVID shots. And Dr. Marsh is going to explain this to us. It is a vaccination due date calculator, and maybe that could help some people to be sure that they're getting their booster shots or their follow-up vaccinations, you know, if they've only had one vaccination of Pfizer or Moderna. But nevertheless, you know, I want to thank all those that are at WVU. There's Dr. Julia Frostino and everything, and she is the director of West Virginia's Public Interest Communication Research Lab. And Stephen Lowe, also a WVU student. You know, I want to thank them both for their efforts in creating this calculator. It's really great work, you know, that's coming from West Virginia University, and we thank them in every way. But Dr. Marsh, if you're on, maybe you want to tell us a little bit more about this.
Sure will, Governor, and thank you so much. So, Jordan, if you could pull that up, the slides, that'd be great. So, as the governor said, some folks at West Virginia University and the Joint Interagency Task Force, including our leadership group, thought it was really important to give all West Virginians a very novel tool, a tool that doesn't exist anywhere else, which is the COVID-19 vaccination due date calculator. And as we know, a lot of times things change at the Centers for Disease Control. So this tool is really made to help each person in West Virginia determine when it's time for them to get another vaccine. So if you basically then go on your web browser to Vaccinate.wv.gov, then this tool sits right below the different graphics there on top. And it's a calculator, and then at the bottom right-hand side of that box is a button that says next. So this is the sign-on page. So what you want to do is you want to make sure that you have your vaccine card with you, if you would. And so then This is the page that you get next after you hit the next button on the front landing page. Just go back one slide, Jordan, please. Great. And then, so this actually gives you the disclaimer, which basically says that we're going to go through, we're going to ask for your birth date, we're going to ask for some information, but it's really important to note that this information is not shared with anybody. Nobody else can see this. This is just for you, or if you're helping somebody else, for the person you're helping determine whether or not it's time for them to get another vaccine or another booster, and when that should be. So if you go through that two screens and hit next, go to the next slide, then what the tool asks you to do is put in your birth date. And the reason why is because we know that only West Virginians and Americans over 5-year-old are eligible for a vaccine, and over 12 years old are eligible for a booster. So you put in your vaccine, you put in your birth date, and then you hit next. And then what the tool will ask you for is how many doses of the vaccine have you received? And if you don't remember, you can put unsure, but that's the reason why having your vaccine card will be helpful, because it will allow you to put the number of doses that you've had, and then you put the number of doses you've had, you hit next. And then it asks you, what was the dose of your first vaccine? So if you've mixed vaccines, it's the first dose. In this case, we answered Pfizer, and we hit next. And then you go through a page to ask if you are immunocompromised. And as we've talked about, immunocompromised really means that you have an active cancer you're being treated for, you're on immunosuppressive medications, you have a known cause of immunosuppression, and we hit no on this one, and then we hit next. And then, so it will ask you then, when was your last dose of vaccine? And this is one that you want your card, and you put in your last dose of the vaccine, and it has a calendar function here. And once you do that, you hit the next button. And then it will give you two different options. One will give you this highlighted area. But if you're due for a vaccine, you can then click right on there and schedule the vaccine to be gotten. And if you're not quite due yet, or if you're not quite ready to schedule, this tells you when you're eligible for the next vaccine, and you can hit that calendar button, and then you can schedule into your calendar a reminder on that date to go get your vaccine. And this is really the tool. The tool is made to help you know when it's time for you to get your next dose or a booster dose of vaccine, or if you're immunocompromised, perhaps the 4th dose of vaccine. And again, this is a unique tool. Nobody else has this in the country. There's no information that's shared, so nobody sees that information. It's just available to you so that you can work that through. And then it gives you the opportunity to both identify when you're due for your next vaccine and to schedule it right off of the tool, or to set a reminder on your calendar so that you make sure that you get the dose of vaccine. And I'm going to make some comments here in a bit that will reinforce, I think, why it's so important that we have everybody keep up with the most recent vaccine that they should get, particularly our older population, our population over 50, over 60, over 70, because of some things that we're seeing in Europe. So Governor, I'll throw it back to you, but we do appreciate the work of Dr. Faustino and her team in putting this calculator together. And this is a wonderful tool for all West Virginians to make sure we're protecting people's health and saving as many lives as we can.
Okay, thanks, Dr. Marsh, and thanks to all those at WVU. I mean, it's always amazing, the great work that they do. It's phenomenal. I mean, if you really just step back and think about it, again, to lead the nation with a tool that nobody else really has, I mean, it's really neat stuff. And on top of all that, it's, who would have ever really thunk it, probably whether it be 10 years or 20 years ago, whomever, that West Virginia University, their medical center in every way, is leading the way across this nation and growing ever more and more popular and everything. It's an amazing story. So congratulations to all of you, and please take advantage, West Virginia. I mean, you know, here we have our great university at WVU stepping up, and they're giving us an opportunity to take advantage, and so do that. I'm not going to dwell on this too long, but the booster shots, you know, are really, really, really important, incredibly important. The numbers still continue to slowly move up, you know, and all that's good. You know, all the COVID information is up on our COVID vaccine, website. I ask you again over and over about taking advantage of free testing. We have 73 outbreaks in our long-term care facilities, none in our church communities. We have 72 inmates and 3 staff members. That's pretty dadgum good work as far as the corrections are concerned. I remind everybody about giving blood. You know, it's especially if you've had this and recovered and everything, and check with your physician, and if you get to go ahead and the clearance and everything, I would highly recommend you consider it. From the standpoint of our at-home tests, the Biden administration is offering 4 free at-home tests and everything, and you can get those by going to our COVID test.gov lines, and the free N95 mask are at the pharmacies and the health centers. Our Jumpstart program to get that one-time check for $1,500 is out there. It's open right now. If we can get you back into the workforce, first of all, we need you. And second of all, it would be a big lift to you. It give you a real sense of accomplishment and pride and everything. And not only that, we'll get you a check for $1,500, provided we got you back in the workforce for 8 weeks or more. And the only other thing I have is my office here is crazy about the NCAA, and they have their brackets, and they all filled them out. And I think there's some additional people that joined in. Baby Dog filled out her bracket, and she's 10th out of 25 people, and that's not too bad considering she had Kentucky and Iowa in their Final Four and lost both of them early, but she still has, one of the real sleepers to the whole tournament that I think is a real basketball team, and that is Houston. But if by chance Gonzaga and Houston would get to the finals, Baby Dog would wrap this thing up and win going away. And not only that, but she'd probably have one of the top brackets in the country. But nevertheless, so if you're rooting for somebody right now, Baby Dog needs you to root for Houston and Gonzaga. That's all I got right now.
All right, thanks, Governor. We'll go back to Dr. Clay Marsh now, our coronavirus czar.
Thank you again. And just to touch on a few issues that we're seeing in Europe and around the world. Europe had, much like the United States and West Virginia, had been seeing a reduction in the number of cases up through January, up through February. But when Europe got to the very beginnings of March, and here I'm talking about the United Kingdom and Denmark and a number of other countries, Germany, they started to see an upswing in COVID cases. And now that's really taken off. And this upswing is all around the BA.2 variant of Omicron. And as we remember, Omicron, which is the fastest spreading variant that we've seen that spreads like the measles does, has 2 different branches. One branch is the branch that we saw in the United States, which was the BA.1 branch. And that's what had all of the incredible spread that we saw earlier in the past few months or around the winter. And now that we're seeing a decrement, as the governor said, we're under 200 hospitalizations, our cases are going down. This is just what happened in Europe. But now Europe is starting to take off again with the second variant, the second branch of that tree, the BA.2 variant. And in the United Kingdom, over the last 2 weeks, 2.5 weeks, they've seen a huge increase in the number of people infected. About 1 out of every 30 people in the United Kingdom have been infected in the last few weeks, and about 1 in every 20 people who are over 70 years old. So Europe now, United Kingdom is starting to give the next boost, the 4th shot, to people that were, or older, over 70 years old, in extended care facilities, but not immunocompromised based on the routine CDC criteria that we talked about just a few minutes ago. And in the United States, over the last 3 weeks, we have seen the BA.2 variant double every week. And this last week, it was responsible for about 25% of the cases. Here in West Virginia, we have many, many fewer cases, but that's what we've talked about before. As Europe goes, and Israel just passed over 1.0 on their RT value, and they're starting to see more cases now. So we know the United States will follow most likely, and then West Virginia follows a few weeks behind the United States. But this is really not to try to scare people, but to give people a heads up. We have a very good opportunity right now for us to really focus on immunizing all of our over 50-year-old West Virginians and boosting all those folks as well. And we know with the Omicron variant, the booster shots are really, really important. And we still have around 50% or so of our vaccine eligible people getting boosters. And so we really want that to go up, and about 60% or so of our over 65-year-old population eligible for boosters have been boosted. And we know with the Omicron variant, particularly the BA.2 variant, the one that they're seeing spread in Europe, is more infectious than the BA.1 variant, the one we just got finished with in the US and in West Virginia. So we know that we have a group of people susceptible to that, and we worry that those people, particularly our older people, if they're not appropriately boosted and vaccinated, we could get into some real hot water again. So it's really important. Use the new vaccine calculator to determine when you should be getting your next dose of the vaccine. And please go ahead and do this, looking forward to the potential that we might see another upswing in the number of cases. How bad that's going to be, how many cases, how many hospitalizations, really is going to be directly related to how well we are vaccinated and boosted. Thank you.
All right, thank you, Dr. Marsh. Retired Major General Jim Hoyer, Dr. Ayn Amjad, Secretary Bill Crouch, and of course Erica Bogus are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Steve Adams with Ogden Newspapers.
Yeah, Steve Adams, Ogden Newspapers. This is probably more of a question for Dr. Marsh. I know you're saying you're not trying to scare everybody. You're trying to give everybody a heads up of what may be coming. But I did think we were trying to get away a little bit from case counts as far as using that as a tactic to kind of push people to get vaccinated. I mean, vaccinations have been largely at a crawl in the state for months. So I don't know that popping on the briefing and throwing out those numbers is much of a scare tactic, even if that's not really the intent anyway. So what is the plan going into this? Because if we know it's more contagious, even if it's perhaps not as deadly or less deadly than the current previous Omicron, what are we doing now to prepare for what we know could be a run on hospitals again by unvaccinated people who get infected with this or potential breakthrough cases? Thank you.
Governor, you okay with me to go?
I'm sorry. I was just looking at one thing, that I was looking up in regard to what, Clay, you were talking about, on the WVU stuff and everything, but I wanted to read a little bit more about that. Anyway, nevertheless, I guess, Dr. Marsh, you're going to end this up. Are you going to end up the question, please?
Sure, I'm happy to. I think that's a really good point about the cases, and certainly as we look around the world, then counting cases has has, started to fall out of favor related to other countries, and the CDC has really indicated the same thing. The concern that we have, Stephen, right now is that at least in the United Kingdom, the number of hospitalizations have picked way up as well. Now, the death rate hasn't, but we know the death rate is a lagging indicator. And given the number of unvaccinated and elder population members that we have here, we very much, in the same spirit that we've put out this new vaccine calculator so that people can see exactly if they are due for another vaccine, how they can get it, and when they should get it, because we are worried about the still two main components of the mission the governor gave our leadership group, which is to save lives and to try to protect hospitals, reduce hospitalization. And for those two reasons, we feel like it's warranted to at least give people the view of what's going on in Europe. But as you suggest, we have seen a reduction in the rate of uptake of vaccinations. We're hoping that the vaccine calculator might be part of what could engage people to look at that and to consider to get vaccinated. But we know that particularly important for our older population, over 50, over 60, over 70-year-old population, to pay close attention to what's going on in Europe and what could happen in the US. Thank you.
All right, thank you, Steve. Next, we'll go to Mark Curtis with Nexstar Media.
Good morning, everyone. It's been a while. This might be a somewhat COVID-related question, but it's the larger issue about the nursing shortage in our state and elsewhere. Governor, last week you gave out, your office gave out a whole bunch of grants, WVU $2 million, West Virginia State $1 million, University of Charleston and West Liberty got just shy of $1 million each under the Nursing Workforce Expansion Program. I know there were other grants as well. I'm just hitting some of the highlights. Why is this program so critical given the nursing shortage in the state? And I'd like Dr. Marsh or Dr. Amjad to weigh in from a medical standpoint too, and in terms of how much COVID has driven the shortage. I know we had the shortage of nurses well before COVID, but give us paint the picture here of how serious the problem is and how much this program is going to go to solve the problem.
Well, Mark, I guess we'll see, at the end of the day, how far it goes in solving the problem, but there's no question that we've got to be able to recruit, and then we've got to retain, don't we? I mean, when it just boils right down to it. And we got to be able to absolutely adequately staff our hospitals, especially, with this nursing crisis that's all over the nation. This is not only that, but in addition to that, this is a way to absolutely amp up our colleges and universities within the state and do things that absolutely will return real dollars in a historic investment to the state. And in making this historic investment in nursing, the nursing workforce is real. And so there's just so many opportunities that are available to us right now, and making a similar investment, that we're trying to make, a similar investment also with our EMS services and everything. And so with all that being said, Mark, I'll let Dr. Marsh, or maybe Dr. Amjad clean up the medical side of it. But really and truly, we have a critical need in the state of West Virginia. So if you've got a critical need to recruit and retain, and absolutely, and I'll just make it as simple as mud. That's what I always do. You got a critical need to recruit and retain. There's no question about that. But in addition to that, if you can spin this thing around to where it is an economic driver for West Virginia at the same time, it's a win-win. And so that's to me is the whole program. But Dr. Marsh, maybe you guys could take over from there.
And you want to start?
Sure, Clay. Thanks, Governor. Mark, the only thing I'll add to that is that, nurses are definitely a critical need to the hospital. They're there 24 hours a day. And without them, the hospitals really couldn't run. So definitely investing in getting more nurses into West Virginia with education, recruitment, and retention, as the governor stated, has always been a need. So anything we can do to invest in more nurses in West Virginia is definitely a need prior to COVID, as you mentioned. But anything else Clay wants to add to that?
The only other thing I would say is the governor said this is really an investment in the state. Having a supply chain, as we have seen with COVID, being internally dependent on our own resource generation, including skilled workforce, is really important. And we know that nurses are in shortage in every state, as well as in West Virginia. So this gives us a wonderful opportunity to invest in people and to create the skilled workforce that we'll need not only for today, but for the future.
Let me end it up and say one more time. I mean, if you had the opportunity to invest and recruit and retain a need that is monstrously important, and absolutely that investment drives our economy in West Virginia in a really, really, really positive way. And the last thing is, it gives us a security blanket. It gives us safety. And so, yeah, it's a great program in my book.
All right, thank you, Mark. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to know if we had any sort of contingency plan in place for backstopping our hospital workers going forward. I know here at the end of the month, the National Guard, will no longer be authorized for the pandemic response. So if and when we do have another wave, what is the backup plan for the hospitals if we can't count on the Guard to come in this time? Thank you.
General, you've got to do this one, sir.
Yes, sir, Governor. Thank you. So, Charles, we are in discussions right now with Hospital Association and hospitals, as well as the primary care clinics across the state of West Virginia, to prepare for what might come next related to surge. Still working through how we would manage those challenges. One option is to make additional use of our primary care clinics across the state to help us relieve some pressure off of hospitals should we need it. But we'll continue to work those and update you as we move forward. We always do have additional options with ability to bring the Guard in, but those options cost a significant amount of effort on the part of Guardsmen who have been at this for over 2 years now, responding to every call that we've asked them to step up to. Thanks.
All right, thank you, Charles. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. Question for Erica Boggess. I'm interested in the portion of the program now for homeowners and those who have fallen behind on their property taxes. Is there someone who would not qualify for that type of relief under the program? Is there a limitation? And are you reaching out through the tax assessor and tax payment offices in the counties? Thank you.
Erica, please.
Okay, so there is a limitation on who may be eligible to get help if they're behind on their taxes. You've got to meet the income requirements. 150% of area median income or lower, but that is actually a fairly substantial number, and it varies by county and by household size, and that can be seen on our website. There's a link, there's a chart you can click on if you're interested on what those amounts are. So that is a limitation. Also, another eligibility criteria is just having some type of COVID hardship that you've encountered, and that's a pretty broad net. I think the biggest stumbling block to keep someone from being able to participate is probably the income limit. And then again, you have to be a homeowner in West Virginia, and these are for your primary residences, not vacation homes, not hunting cabins, those kinds of things. And then to your question about reaching out to the different tax authorities, we have not done that specifically. We're concentrating our outreach on, reaching just the general public, but something to make a note of.
All right, thank you, Paul. Governor, I'll turn it back to you.
Okay, like I said, I had the opportunity, to sign 3 bills or do a bill signing, today. A bill that was increasing compensation for all the folks on the county level and lots of different areas there and everything, whether it be sheriffs or county clerks or whomever, and a prohibition, against abortion, for, that would be, abortion, that would consider disability, which is, it just seems terribly discriminatory in my book, and also, considering disability, when considering organ, when looking at the possibility of organ donation and evaluating it, considering disabilities. Well, all these things just make us better and make us stronger in our state and make us more proud. And so if you could have been out there with all those kids, there was some kids out there, no question, that were struggling with different things. And, but those kids were so happy and such wonderful, wonderful gifts to all of us. So, so I'm really proud to do it, and get, it's a great honor to be able to sign those into law and do that ceremonial signing. But at the same time, I congratulate the legislature for a lot of really good work. And so, doing good stuff, and that's what we want to continue to be able to do here. The only other thing that I wrote down, and I've just made a little special note on this, and again, I am very plain spoken, and I can make it real easy. This new homeowners program is an absolute potential windfall to West Virginia. This is money coming from the federal government. This is just like, stuff falling from the sky. I mean, that's all there is to it. You're going to have a hard time not being able to qualify for this, really and truly. Now, if you've got an income that's greater than 150% of the median income of the area that you're in, one thing. But for crying out loud, the area in itself is being substantiated by people with an income that matches the area. But the government is giving you 50% even greater, 150% of what is average. And so there's going to be a boatload of people that are eligible, and you're eligible for all kinds of different, funding, whether it be, taxes or whatever you're behind on and everything, your utilities, different things, your payments, your mortgage payments, whatever. But this absolutely, if we get the word out and get the word out correctly and everything, this will even drive us even more, because every one of those dollars is a multiplier dollar. And whether it be 10 times, 14 times, whatever, you remember all the time, I'm the business guy, I'm the math guy, and I can do this right real fast and everything. And with all that, really and truly, it is an absolute potential windfall for West Virginia. We want to take advantage. We want to move forward, and so we just got to get the word out. So nevertheless, that's all I have, other than the fact that I wish to goodness that you could have been there with me with those kids. Of course, everybody knows that I love all the kids, and they renew all of my strength. And but they were just absolutely wonderful. Great stuff. I go back over and over and over, and I'll say, I don't want to bore you, but I want to tell you just this. Rodney Weichel was the athletic director at Greenbrier East High School when they hired me first time, when they hired me originally, which was 21 years ago, as their girls basketball coach. Then I became the girls and the boys basketball coach. Now I'm still doing the girls. And I do that because I love the kids. I don't go anywhere. I don't go on vacations and stuff. I stay here. And that's exactly what I want to do. But Rodney Weichel said something I'll never forget. He said, kids know if you like them. Just think about that. Kids know if you like them. Well, honest to goodness, if you could have seen those kids around me out there and everything, they absolutely know I love them. And it is really meaningful to those kids, but more meaningful to me. So nevertheless, we got a lot of good stuff going on here in West Virginia. Let's just keep it going. Thank you all so much.